Hi, I'm Virgil. I work with pediatric cancer patients and their families. I'm here to help you understand chemotherapy. The word chemotherapy comes from chemo or chemical and therapy or treatment. In other words, chemotherapy uses specific chemicals to treat cancer. These medicines work to kill cancer cells or stop them from growing. The human body is made up of trillions of cells that are always growing and dividing. Cells are controlled by special signals that tell each cell how to grow and function. Signals also tell cells when to stop growing when they become old or damaged. Sometimes cells change or mutate so that they continue to divide and make more cells even when they're supposed to stop. These cells do not respond to the normal signals that control healthy cells. Cancer cells may divide faster than normal cells and can spread to different parts of the body. Chemotherapy, or chemo, works to kill or slow down the growth of cancer cells. Different medicines may be used depending on the type of cancer. Chemotherapy can be given in several ways. It may be given by a pill or liquid that you swallow, or it may be given through an injection, through an IV in a vein that carries the medicine through the blood. For some brain tumors and leukemias, chemotherapy can also be given into the spinal fluid. Depending on the type of chemotherapy, patients may receive treatment at a hospital, clinic, or at home. Chemotherapy is typically on a specific schedule known as cycles. The goal of the chemotherapy schedule is to maximize the work of the medicine and to give the body a chance to recover. Because chemotherapy works throughout the body, it can affect other cells in addition to the cancer cells. Chemotherapy targets cells that grow and divide quickly, like cancer. But chemotherapy can harm other fast-growing cells in the body, like the cells that line the mouth and intestines and the cells that cause hair to grow. That is why side effects like mouth sores, nausea, and hair loss are common. Chemotherapy can also kill off cells that fight germs and illness, so patients are often at greater risk for infection. There are things that can help patients manage common side effects, so talk to your care team about any symptoms you experience. Side effects often get better or go away after chemotherapy is over. Some chemotherapies can have longer-term side effects, which depend on the medications used. Your health team can answer questions about possible short and long-term side effects. There are many different types of chemotherapy medicines. Chemotherapy is planned according to the type and stage of cancer, the goals of treatment, and other therapies that are used. For some patients, chemotherapy will be the only form of cancer treatment needed. Other patients may receive chemotherapy to make a tumor smaller before surgery or radiation therapy. Chemotherapy may also be given after surgery or radiation to kill any remaining cancer cells. For many people with cancer, chemotherapy is an important part of treatment. Your healthcare team can answer specific questions about your cancer and treatment options. Now that you know the basics of chemotherapy, look around the site for more information on chemotherapy and other cancer treatments. And please remember, we're here to help you face pediatric cancer together.